The Centre for Cultural Diversity vision is that we want all aged care consumers in Australia to experience inclusive and accessible care. Some of our service areas include inclusive practice, training, and workshops, such as this one, capacity building to promote cultural inclusion and equity, which are many of the resources that we have on our website, and diversity advice and consulting, which is the individual advice we provide to government agencies and also aged care providers. I would like to mention that the Centre for Cultural Diversity in Aging is supported by Benetas and funded by the Australian Department of Health throughout the Partners in Culturally Appropriate Care PCAC program. The agenda for today is diversity approaches. First off, we have Kath Paine from Bolton, Clarke. Then we have a panel discussion, diversity approaches and learnings. The panel discussion is consisted of Stephen Holmes from Goodwin Aged Care Services, Yvonne Timson from Community Vision, and Gail Alexander from Calvary. Then we're going to go to our Q&A section, which will be hosted by Nicholas Rittenhausen, who is our senior advisor. And then we're going to launch our new practice guide, 10 Steps in Developing a Diversity Plan in Aged Care, with our manager, Lisa Tribusio. She will also talk to you about how to find further support. I have now the pleasure to introduce to you Kath Paine. So Kath is the Principal Advisor for Wellness and Reablement at Bolton, Clarke. Her role supports the organization's commitment to diversity and inclusion. She also leads the consumer engagement strategy throughout both the Bolton Clarke community partnership groups. Kath has enjoyed a 30-year career in community-based aged care as a nurse. This includes an 8-year secondment to the Victorian Department of Health and Human Services to lead the Active Service Model Initiative and support sector development teams across Victoria. Thank you so much, Kath, and the floor is yours. Thank you.
It's a really great opportunity, and I'm very proud to be invited to talk to everyone about our Bolton Clarke well-established diversity strategy. So setting the scene for you today, all of us want our service to be welcoming and where people feel comfortable and safe. And I've been asked to talk today about our diversity strategy. It supports our staff or volunteers to remove barriers for people and to help to create environments that are welcoming and safe. To do this, we need to know our community, and this means understanding the diversity of the people who live in our local area and why some sections of the community are not accessing our services. We do this by developing partnerships, and it is important to be able to work with local communities to understand what's important to them and how we can respond appropriately, especially when we're providing health and aged care. And even though we have a well-established framework and strategy across our very big organisation, we are constantly identifying areas that we can do better, and it's a constant evolution of improvement. So before I go too much further, I'd just like to give you a bit of a sense about why it's really important for us to have a strategic approach to diversity and inclusion. Our organisation, as of about a week or two ago, now supports 70 residential care communities, 36 retirement living villages, more than 130,000 home care clients across Australia, and we now have become the largest provider of home support, retirement living and residential aged care. We have more than 10,000 staff. That's a lot of people to influence and to support. Data from our 2021 system tells us that our clients and residents originate from 187 countries and speak more than 119 languages. So there you go. It is a very big organisation, and that's why it's really important to have a strategy. And our diversity strategy starts with a commitment from our Board of Management. We have an executive sponsor who drives our diversity framework across Bolton Clarke. The framework becomes our organisation-wide plan, and it helps us to understand and respond to the diverse needs and choices of people. The strategy strives to include diversity and inclusion as part of our organisation's governance and quality and safety systems. It aligns with our organisation objectives, vision and values. It has a dedicated position within our organisation, and that position coordinates, implements and evaluates and reports on the outcomes of the strategy. It also helps support the establishment of policies and practices to address diversity. We have a range of policies and guidelines, and I can show you some of those at the end of the session if we have some time, and I'm very happy to connect in with people if you want to know more about those. We also have 6 measurable objectives within our diversity strategy, and I'll talk a little bit about those. Okay, so at Bolton Clarke, we currently are working with our 2017 to 2025 diversity framework. This is where our strategy is set out. The framework's purpose is to outline and use Bolton Clarke's definition of diversity, and we focus on the 3 foundations. There are 3 foundations for diversity, and they are partnering with consumers, health literacy, and the conceptual model. The framework encourages and supports diversity across the wider organisation to embed workforce inclusion and to embed consumer participation. So we talked about having in our strategy, we have a definition of diversity, and it's really important that we have a shared and consistent understanding across our large organisation about what is diversity. And for us, we have said that diversity is about what makes a person unique and different and includes identity, life experience and beliefs. At the same time, it's about the shared characteristics and values that connect a person through groups and communities. Okay, so I did talk about the 3 pillars, I suppose, of our foundations of diversity in our framework, and a little bit more about those. So to be truly person-centred, we have to understand that our communities are made up of people with multiple person-centred specific diversity characteristics, and those characteristics can impact on their equity of access to services and care. So firstly, I'd like to talk about the conceptual model. This supports our workforce to identify and understand diversity and implement person-centred practice. I'll go into a little bit more detail. We'll show you that and how we use it in practice coming up. The second component is the partnering with consumers in order to design and provide services suitable to their needs and wants. And as mentioned in the introduction, I actually coordinate several community partnership groups across our organisation, and we're about to pull together a new group up in Queensland as well. And the third foundation is around health literacy. And this is to support, we have a health literacy policy and a guideline for developing consumer information in plain language, which is a really useful, simple checklist. And it makes sure that we're constantly considering all the principles of health literacy. So whenever we're developing any client-facing information, we're applying that checklist and that rigour to it. Okay, so earlier I mentioned one of our key components of our framework is the diversity conceptual model. This is used to train all of our staff to help them to understand and identify diversity, and in turn allows them to be able to respond to the person and their individual needs. A person's diversity characteristics are the main things that may cause barriers for people who want to access health and wellbeing needs. This list is not an exhaustive list. The categories are quite broad. The diversity conceptual model is used as a tool to help design and develop consumer information, to inform policy development and more inclusive service pathways, to support clients and resident assessment and care planning, and also for the professional development of our aged care workforce, and which, as I said, there's now more than 10,000 staff. So this will be used at every onboarding orientation session for all staff across our organisation. It gets them to think about, we use this also in conjunction with our digital diversity stories, of which there are 6, and it gets people to, staff to think about all the factors that can, are unique to a person and how those factors can influence their ability to access care, what their health outcomes might be, and how we need to tailor our support to ensure people can participate in their care. The model is embedded into our client information management system. So it pops up when you're doing an assessment and it prompts staff. It helps them to consider all those things they need to put into play when setting up and developing plans. So we've also been very lucky to receive a Commonwealth Government grant. And this grant was awarded to the Bolton Clarke Research Institute, where we used the money to develop the Inclusive Health and Aged Care website. This website contains multiple evidence-informed resources to support service providers and consumers. So there's information for all there. It's broken up into 4 components: lived experience, health and wellbeing, environmental considerations, and diversity planning. At the end of the session, I'll try and jump onto this website for you and show you what that looks like, but I'm happy to share the link. What it does do is it has information by key organisations in those areas. It also has information for consumers. It has information for health professionals, and it also has a reports and policies section. So it's a very comprehensive website. We have support to help staff. Lots of resources are there to help our staff. And I did mention earlier that we used our framework, and it feeds into the development of policies and procedures. So I've just put a couple of the examples here about what we have to guide staff. The key one is the Valuing Identity, Culture and Diversity guideline. So for staff working out in the field or in our residential care, we've taken the framework and we've put it into the role specifically for staff, so that they can understand the framework and how it relates to their roles. As I said earlier, everyone has a role and a responsibility for embedding diversity and inclusion within our organisation. So this is how we cascade the high-level information out of a strategy and a framework down to the everyday information for staff and what they need to do their jobs. We've got protocols and guidelines on working with interpreters, supporting carers, health literacy, as I've mentioned, and another one around working with Aboriginal and Torres Strait Islander people. To support our staff, we also have a large diversity page on our staff intranet, and they can go in there and look at resources. It'll take them to links all around external providers and other organisations as well. And it helps them to connect with the subject matter experts within the organisation too. To support the leaders within the organisation, we've had an established iLead program, and that's currently been available internally for Bolton Clarke staff. And it's very much has been originally catered for our context and our sites, and it uses Bolton Clarke language. But we're currently adapting these 4 topics, and they will be recorded into short presentations around the 20 to 30 minute mark. And I've just been given the wind up that I've got a few minutes to go, so I'll crack on. So they'll be available later in 2022. We've got a range of supports that I'm sure people will be quite familiar with to support our clients. These are all available via our website as well. You can look at the digital talking books. There's medicine reminder cards. We use the national language line. We have access to interpreters. And all of this information is included in our staff's onboarding and orientation. One of the key things I did want to play for you, we might just have enough time to do that, is our digital diversity story. So as I said earlier, we do have a way of bringing to life the diversity conceptual model so that it really resonates with our staff.
And I'm a clinical quality and risk manager. I would like to tell you a story told to me by a staff member. Mrs. D is a 68-year-old with Maori ancestry who was born in Christchurch, New Zealand. She was living with her elderly parents and her younger brother and his wife when an earthquake occurred. Their house was completely destroyed and they were left without a home. When Mrs. D's brother found a job in Melbourne, her family decided to migrate as well. 5 members of her family are currently settled in a small unit in the southeastern suburbs of Melbourne near extended family. Mrs. D's family are members of the local Catholic Church and they attend services each week. She helps her extended family care for her father, who was recently diagnosed with stomach cancer. Mrs. D is 160 centimetres tall, is morbidly obese, 135 kilograms, and has type 2 diabetes. She also has a leg ulcer. The family speaks Maori at home. Mrs. D had limited opportunities for schooling and finds it difficult to read English. She had problems with self-managing her diabetes and her wound, so receives support from Bolton Clarke nurses to manage these. All support provided by Bolton Clarke is demonstrated and discussed rather than given to her in written form. Mrs. D is unable to reach down to wash or moisturise her legs. Bolton Clarke personal care staff provide assistance with this. Mrs. D's family also uses traditional Maori medicine to complement the service provided by Bolton Clarke. Migration to Australia has further disadvantaged Mrs. D, as well as experiencing isolation and settlement issues. She is also facing greater financial disadvantage. She cannot afford the wound care products, and as a newly arrived migrant to Australia, she is not eligible for any benefits. In New Zealand, wound care products are provided free of charge. Bolton Clarke, however, has helped Mrs. D to pay for products through an internal trust fund. Mrs. D's management of her diabetes has improved immensely and her wound is currently healing.
So that was how new staff are introduced to diversity within their orientation, and we use this information because all of these categories are also embedded in our client information management system. So as people identify pertinent issues for people, it helps them to plan for care. So a discussion around what would happen next for Mrs. D would occur during that orientation session, and as a group, it really gets the staff thinking about all the issues around access and equity, planning and potentially, and how they can support Mrs. D to really be able to actively participate in her care. So it's how, for me, this is a really great example of how that strategy for diversity becomes realised when we're working with our clients and their families. So thank you very much. I think I must be out of time by now, and I'll hand back over to the team.
Thank you so much, Kath. And now I have the pleasure of introducing to you all our panelists. Firstly, I would like to present Gail Alexander. Gail has worked in health for the past 30 years. Since joining Calvary 12 years ago, she has held operational roles in disability and community care services, and for the past 4 years in a national mission leadership role. Currently, she is leading the development of an action plan to implement Calvary's diversity and inclusion strategy. So welcome, Gail. Next, we have Yvonne Timson. Yvonne is a highly qualified and experienced CEO, proficient in both governance and corporate environments. Yvonne has held senior roles within the aged care, disability, and mental health sectors over the past 15 years. Yvonne's passion for social justice flows throughout all operations to improve diversity, inclusion, flexibility, autonomy, and fulfillment for all consumers and staff. Welcome, Yvonne. And last but not least, we have Stephen Holmes. Stephen has worked in the aged care sector for 7 years as the Chief Operating Officer of Goodwin Aged Care Services. He has more than 25 years' experience in a non-for-profit sector, including housing, education, health, community care, sport, clubs, and animal welfare. Stephen is passionate about ensuring support is provided to those who need it when it is needed. Stephen is also a director of a local disability services provider. So welcome, Stephen, and I'll leave it up to Nikki to conduct a discussion.
Thank you very much, Biljana. We have great panelists. So we have Stephen, Yvonne, and Gail. Welcome very much to our panel discussion. I really look forward to having that conversation with you. We have 100 people in the audience, so that's really amazing. We really appreciate your participation. So I will ask you all a question, and we just go around and see what you have to say. So the first question, I might direct it firstly to Gail, is tell us a little bit about your role and organization and how your diversity, equity, and inclusion journey has been so far.
Thank you, Nikki. And I think part of my background is being explained by the introduction from Biljana, but I think what's really informed my work that I'm doing at the moment has been the relationships that I've formed with the people in our care and our staff over the time of 12 years at Calvary. And I think it's that quality of listening attentively to people's stories, to understand where the barriers are for them, to understand how much people value you reaching out and talking with them and being very interested to know in how they're going with their work, with their clients, patients, residents. I think that's been really useful in terms of informing the work we're doing now at Calvary. Certainly I've found little strategies such as sending everyone a welcome card when they start with us and phoning people to see how they're going, and also a weekly email to people is just one way of connecting with people, and you learn all sorts of things that you never hear about in meetings, and it's great to hear those stories and amplify them in the right arenas. So I can take those stories and they go up to the board and they go to our trustees and they go to our executive, and I think it brings that picture of the diversity of our organisation alive.
I really like your personal approach and how you engage with the community and feed that up to the management and board level. Thanks, Gail, for that. Maybe Stephen, do you want to go next?
Yes, thank you, Nicholas. So I think Goodwin, our organisation, I would say, has taken a tortoise rather than hare approach to diversity within our organisation. I expect that many people who are attending this webinar will be the same. We would certainly classify ourselves organisationally in that category of intermediate from your last poll as well. So we're definitely not at the beginning, but we're definitely not advanced. And it has been a process for us that has really started to embed more formally things that we were ordinarily doing as part of providing services in the residential aged care sector and to our clients and residents, such that when we decided to start, formalising diversity, equity, inclusion in our organisation, we already had the building blocks there in the way we provided services and the things that we did, but we weren't calling it a diversity strategy, or we weren't calling it an equity inclusion strategy, etc. So we did commence a more formal process back in 2019, a process not dissimilar to what Bolton Clarke has just communicated in starting with a framework. You have to start somewhere, obviously. So we started with a framework and tried to understand what we were trying to achieve in a more structured way and what diversity meant to our organisation. And I get that process, similar to Bolton, Clarke, and like many of the organisations attending today, will have had board input and board approval. And that's really where we started from a formal sense. And from there, it cascaded into, that's great, we've got a framework, but really, what does that mean? It's a nice, glossy document, and it's not just a document, but it sets out the principles, it sets out the statement of commitment, and I think that's a really good thing to do for those that haven't yet formally started this sort of process, that there needs to be, a statement of commitment levels in the organisation, and that then needs to become visible across the organisation, and that adds weight to whatever follows from that. I've got lots of other things we might cover today, but I might just start there and stop there, and that I will talk about probably later our diversity action plan, which is our next level down, and some of the other things that we will cover about our learnings and the pitfalls, and how to scramble when you think you need to scramble.
Thanks very much, Tim. It's amazing to see how you have step-by-step progressed and each the stage where you're at the moment. And that's really amazing. Now, maybe we go to Yvonne, our next panelist.
Hi. Well, I suppose in one way, building on what everyone else has said, but we're slightly different because we're not as large as both Gail and Stephen. So we're able to probably not, and I think probably many people in the audience today who you're not as large may not have the resources to put so much into large frameworks and large things like that. So I think if anything I can add today is that you can do it at different levels, which is appropriate to your size, and still achieve a great result. And it's no different to what Stephen or Gail are doing, just in a different size and an aspect from that. From me, we've worked at Community Vision, and we were lucky enough to receive a grant where we did a lot of cultural work around how you engage with communities, a little bit more in the disability space, but we built models on how we can actually engage with different communities, whether that be Aboriginal, Torres Strait Islander, and you can imagine the size of WA, we have quite distinct groupings and the tyranny of distance, and like other parts of Australia. So it was a really interesting project. And what was great for me now to see with some of the Bolton Clarke work is their conceptual model is very similar to the model we've built around community and engaging. So we've used the principles of those. And again, great to see health equity, because we know that equity and that health literacy is so important when you're looking at barriers and diversity and inclusion. So our journey kind of started from there, but we keep it at a policy level, not necessarily at a large framework level, and embed it into the person-centered approach, because we find our support workers can connect more when approaching it like that, rather than thinking about it in a different concept. So I suppose it's just a different cover in a way. It's no different, but that's how we approach. But a lot of our journey has also gone around that cultural safety and services, around the whole rainbow community and supporting the community. And we've even gone as far as implementing transition leave for anyone who's questioning their gender. And we've put that out as well. And to various different responses from the community as well. And if there's one bit of advice I can impart, is that it can at times be a bit of a rocky journey when you're trying to have these approaches, and some people may not always agree with you. But it's really important to stay true to those principles and true to the fact that it is about equity, it is about inclusion, it is about diversity, and that strengthens you as an organisation, both from a business concept and from a person-centred concept.
Thanks very much, Yvonne. I just maybe make a follow-up question to you, if that's okay, because it's very interesting what you were saying, including what you were talking about the community engagement. You have similarities with with Bolton Clarke, so it's interesting to see how people are having similar concepts in mind, even they are from different organizations. Now, my question is: do you think, Yvonne, that in terms of diversity, equity, inclusion, should that be, I guess, as sort of a separate strategy, or should that be part of ongoing policies and operational activities?
I think there's no right or wrong way. You've got to find what's right, fit for purpose for your organisation. So for our organisation, we don't have it as a separate thing. We embed it into what we do. So our customer reference groups and advisory groups, we also use that as our and having diversity champions and inclusion champions in our customer reference groups as well. So we actually include that within those meetings. Our staff safety meetings, we also have a diversity and inclusion section on them. We have champions on those committees as well. So we embed it, but that's what's right for us. As an organisation, like Stephen's got his framework, Gail's been doing loads of work within Calvary. They have that strategy. You've got to find what's right for your organisation that can have the buy-in from the board all the way through, that they understand the concepts, that they can get behind the concepts, and actually everyone take responsibility and ownership to drive it forward.
Thanks very much, Yvonne. That's great. Now we go to the next question, and I maybe ask this to Stephen first. What has been you have talked about some of it, but if you could also elaborate on your action plans you mentioned before, what has been your organizational approach to diversity plan in practice so far? What have been your key learnings in relation to influencing organizational change regarding diversity planning?
Lots of learnings, and everyone will have lots of learnings. But our approach was to, if I would summarize it as start small, not a big bang approach. As Yvonne said, the approach needs to be appropriate to your organisation. It needs to fit in with your ethos, fit in with your organisational structure in terms of getting buy-in. We haven't treated it as a change project as such. Some organisations will treat it as a full-on change project. We've certainly not gone down that track because we didn't think that approach was appropriate for us. And by no means are we a large organisation at all. I mean, we only have 600 staff, so we're not large, and certainly nowhere near comparison to Bolton Clarke, obviously. And we have, I guess, the benefit of geographic centricity in that we are located 95% within the ACT. Getting traction and implementing a lot easier than it might be for larger or even more geographically dispersed organisations. So I guess our approach was, as I said, was to start small, really undertake, I guess, a bit of an assessment against the aged care diversity framework that the government put out a number of years ago now, 5 years ago now, and building on the information resources from CCDA as well about the inclusive service standards, and get all of that information and say, okay, what does that mean for Goodwin? What do we think diversity and equity inclusion is for Goodwin? What does it look like? And almost paint the picture as if we had to describe what this looks like in practice, or what do we want it to look like, I should say. And then you're almost doing a gap analysis then of where we are now. You do your self-assessment, like anything. What's the end state? As far as you can tell at that point in time, you want the organisation to look like in respect of all of this. And then that essentially then creates your action plan. So we have, as I said, in 2020, we created our action plan, which, like all good action plans, has ownership and accountability and timeframes and evaluation. We, by no means at the end of our journey. We're in that intermediate category from that poll, and we've still got a fair bit of work to do as well. But what we found as an organisation, and it was mentioned a little earlier, it's the person-centred approach. That's where we really started. And these topics of diversity and equity inclusion are all very nice terms, but they mean different things to different people. So it's really trying to, and even within our executive team where this started, when we started very early on in this project, we almost did a around the table to say, what does this mean to you? And the variety of response that came out of that was quite surprising. I guess one of our biggest learnings is around self-reflection, that within our executive team, we have very little diversity. So we started to look at ourselves and thought, essentially, we're 80% of us are all the same. So you come to those discussions with a certain lens before you even try and determine the way forward. So there are learnings there for us and actions there for us, even on that front. Some of the other learnings that we had, and I'll be brief, I know we haven't got all the time in the world, but design and co-design of the actions was really important. And I know the other panellists will have comments on this and experiences around this, that as an organisation, we can't pretend to know everything. So let's utilise the knowledge and life experience that exists within our staff and our client base, our resident base, to really build a quality outcome that we're looking for. The other thing was just get feedback as you go. We have an action plan. Some things work better than others. Obtain the feedback both internally from your staff and from your residents and clients about the changes that are making. Is it really achieving what we think and we would like it to achieve? Lots of other learnings, but I'll pass on to the next person now.
Thank you very much. That's really an amazing conversation we're having here. So I really like this panel discussion. It's really very vibrant and lots of different angles. And I love how you were able to, use the inclusive service standard and adapt it to your own needs and make it useful. Also, include the co-design approach. Now we go to, thanks very much, Steve. Now we go to Gail.
Stevens touched on a lot of key learnings and acknowledging what Yvonne has said about having a lot of resources in a large organisation. You also need to fight for your oxygen. So there's a lot of projects going on across the organisation, really great initiatives. We're getting into a lot of partnerships with the government, supporting people with COVID in their homes. We've got things going on in our workforce strategies. And so the resources are certainly there and it's prioritising. I think one of the wonderful things and one of the first things that impressed me along this journey, which I actually must say I've started 3 times, first in community care, and then as my role changed in the combined aged and community care background, and then finally with the hospitals in mind, so that national approach. And when you're talking about a whole pile of hospitals and 70-odd residential places and 19 service centres providing community care services up in the Northern Territory and in all states except Western Australia, it starts to get quite complicated. And the great advantage has been that aged care, I think, has done a lot of work in this space already. And certainly, like Stephen, I drew on the aged care diversity framework. I drew on the inclusive standards. I thought they were fantastic. I liked the way they had performance measures. But one of the heartening things about this work at Calvary has been the staff have been driving it. The staff are quite passionate about it. They were calling Calvary to make a statement on this. And so we made a commitment statement and from that developed the strategy and then the action plan for implementation. What I haven't achieved is a structured implementation of that action plan. And in a way, I have to acknowledge that it's actually all happening around me without a grand plan. So there's organic work going on. And I think we need to celebrate that too. So in some places across our organisation, they're well advanced in this diversity space. In the hospitals, I have to say, they're more focused on respecting the diversity of our Aboriginal and Torres Strait Islander people, our First Nation people, and it won't surprise you to know that that is in their hospital standards. Whereas in aged care, we've been much more inclusive and we're looking at all types of diversity. And so trying to tread that fine line to get everybody on board for a holistic approach to diversity, equity and inclusion has been a little bit of a challenge. But I think we need to recognise that some people are well down the path of using multicultural advisors for patients in hospital so that they're not left wondering about what their diagnosis is or what the treatment is. It's bringing our First Nation people in to be with and escort a body after death so that that respect for culture is existing. So even though that action plan hasn't got a formal start date, the things that were identified by the working group, which was quite a diverse working group, are starting to happen and they're happening organically and they're happening with passion and they're being led by people that are very keen about it. So in lots of ways, there's a two-pronged approach there.
Absolutely support both what Gail and Stephen says. Again, it's around what's finding great for you to get the traction, because it's all about the outcomes. You can put as much work in it as you want, but if you don't get the outcomes, then why are we taking this journey? I think I want to touch on something. slightly different to give someone some maybe some examples. You know, for us, we had a bit of a backlash from the community with one of our strategies around using the gender transition leave as a policy decision for our workforce, and you know, even attracted some state-based press and radio, to the point where we were being pushed into saying that by having this diversity and inclusive approach, that somehow we are then forgetting the rest of the people in our organisation. And, you know, I think it's really important that you're able to understand why you're going on that journey. So if you do get the pushback, then you can explain why it's important for you and why it's important for everyone in the organisation. And to go to Stephen's point around the whole exec had a different view, that's the same, you know, in this, you've got to be able to, when you have that embedded within the organisation or start on that journey, to have a consistent view of why you're doing this for the organisation and your community. If you all as leaders can articulate that, you've got a chance to bring everyone else on the journey with you.
What's your vision for future diversity planning within your organization? Any sort of vision you have, how you want to see in the future diversity planning with you in your organization?
Oh, absolutely, because it never stops. I mean, that's the one thing around diversity and inclusion, it never stops. You know, we've got, as everyone will know, this absolute driven reform from the government. You know, that is going to impact what your strategy is as well. How do you ensure that you maintain your diversity and inclusion around the changes in the programs that are coming out? How do you ensure that health equity is put in place? You know, so when we talk about a vision, is sometimes it's hard to articulate because you've got other people making decisions that are impacting your business when you are in a sector like aged care. But I think what you've got to be open to with your plan is that it has to be agile. It has to take in account of things that change in the rest of the sector that you then have to analyse and go, okay, is our approach still now correct? Do we have to change it? Do we have to move it forward? And then equally, your communities are constantly changing, right? You know, you only have to look at the census to look at that. You know, our communities are constantly changing. There'll be new barriers. There'll be new things coming in place. You know, so it's never going to stop. You've just got to be open. Your vision has got to be open. And I think that would be the best advice that I give to anyone, and not think you're ever going to win the journey. It's just part of your journey.
Thanks very much, Yvonne. Gail, do you want to elaborate on that as well?
Thanks, Nick. I think in the future, what you want to be doing is to evidencing progress, and you want to be able to show that you have brought that diversity through your senior leadership ranks, that your executive is reflective of the diversity of the organisation, that the people in our care have a voice, that our staff have a voice. You know, are we listening to whether there is really equity of opportunity? Are we valuing the diversity that they bring to the organisation? So I think, you know, amplifying the good news stories, amplifying the situations where some things we've put in place are working, but also being attentive to the feedback from our clients, residents and patients, and acting on that. You know, a story, we say we've got this in place, but at the coalface, a patient's told us that they're non-binary, and yet the staff are getting tongue-tied about how they should speak to that person. And if we go back to the basic courtesy of how would you like to be called? Yeah. You know, that's a basic courtesy of caring for someone, but we're getting tongue-tied because we don't want to say the wrong thing. And so I think that's often the litmus test of whether what you've got in place or what you say your vision is, can it be translated? Can every staff member articulate that? And can they behave in an inclusive, welcoming way to everyone that comes into our care?
My vision is very simple, is that everything that we're talking about now becomes normalised. We have the topics of obviously diversity, equity, inclusion, and there is still stigma that goes with all of that. the ultimate vision, which I'm sure it is of CCDA as well, is that conversations like these almost, in some respect, don't even need to happen, because behaviour and action and everything that comes from that becomes normalised in the way that we operate. Now, that's a fairly utopia position because we deal with people. People are far from perfect. So, as both Yvonne and Gail have said, incremental improvement and evaluation and progress is the vision.
In terms of the diversity framework, have you been using the government's diversity framework? How useful have you been finding it? And have you been working with some of the specific groups of the diversity frameworks?
Actually, we've utilised the government framework or their action plans to develop smaller action plans for all of our managers across the sites. So we have sort of broken it down, and we've got some outcomes. We've got 6 outcomes for consumers that are embedded in that. And then they've got a whole lot of actions which we've brainstormed and put in there about how that might look in our organisation. And then we regularly check in with the managers about those action plans to find out, what they need, what support they need, how they're tracking. And it's a way of giving everyone a bit of a structured, systematic way of working through all the steps that they need to take.
Gail, you're nodding. Is there anything that you would like to say, or anybody else, really?
I was nodding because I think we need to really emphasise today there are fantastic resources out there to help if you are just at the beginning of your journey. And I would also encourage people to reach out and make networks, because there's nothing better than knowing that there's 10 of you in the boat and you're not the only one at that stage of the journey. But I certainly found the aged care framework very useful. I was trying to make sure I covered the length and breadth of our services, and so I found myself consulting the National Disability Standards, the hospital standards, the aged care standards, and getting myself not tongue-tied with standards, but I was cross-referencing everything. So I think that's useful. We had 5 objectives, and the first one was just to create a welcoming, inclusive organisation. And that became quite a serious objective because we had feedback from patients, for example, that we were just a hospital for white Catholics. And so suddenly we've excluded most of the population. So we needed to make sure that we were an inclusive organisation, and just by articulating our values at Calvary in this lovely document, which we called the Spirit of Calvary, by stroke of luck, the opening lines are, everyone is welcome, you matter, we care about you. And then we went on to describe what that meant in terms of person-centred care. And that applies to all of the people in our care, but it also applies to our staff. And I think using that line was a great way of breaking down that sort of concept that both our staff and our clients and patients and residents could have too, that it wasn't just for a certain part of the community, it was for everyone. So that was very useful.
On your diversity journey, have you worked or partnered with any organizations to be able to better fulfill your diversity planning and practice? Any sort of multicultural organizations you've worked with successfully, or refugee communities? Anything that you did in terms of engaging and partnering to be better when you deliver your diversity practice? Thanks. Anybody wants to go? Yvonne?
Yeah, I mean, we've worked with our local PICAC provider because they're a great resource. We've also got some elders in our community we often work with, and also because of the other grants that we've been able to be successful in working with different communities, we've stayed in touch with those community leaders and have always gone to them for feedback around ideas or contribution. And look, you might not always like what they tell you, and sometimes it can be pretty blunt, and that's okay. And so we found that pretty invaluable working with other partners to even have a different perspective, because as much as we go on this journey, we also know that sometimes we have our own lens and our own unconscious bias. So it's really important to allow other people to challenge that so you can see it yourself.
So really thank you, Stephen, Gail, Yvonne, and Kath, for your amazing insight. It was such a good conversation with you. I really enjoyed having the conversation. Even we're not face-to-face meeting each other, I felt there was a really good vibe in the room, really great buzz. And we thank also all of the participants who joined this conversation. I really thank you for supporting the Centre and for working with us.
I wanted to now officially launch our new practice guide, which is 10 Steps in Developing a Diversity Plan in Aged Care. And this practice guide has been in response to our consultations with aged care providers around the fact that perhaps there needs to be a little bit of guidance on how to develop a diversity plan. We suggest that in order for equality to be achieved, that we do need to have explicit policies and procedures in place to achieve equality. And so therefore a diversity plan or inclusion plan, for example, is almost necessary in order to achieve equality. Whether it's integrated across a whole organisation or it stands alone is up to you how you do it. But we've got this guide to help you look at a 10-step process. So it is available on our website under practice guides. I'm going to quickly share the guide with you, just to have a bit of a look around what it looks like. It is quite comprehensive this time round. A lot of our other practice guides are a bit of a high-level overview of the topic. And so we kind of looked at this one a little bit more deeper. So it looks into a bit of an overview of some of the policy frameworks relating to diversity, equity, inclusion in aged care, such as the special needs groups mentioned in the Aged Care Act, which I think is going to be looked at under the new aged care reforms around having a human rights focus. The Aged Care Diversity Framework and associated action plans, which have been mentioned by the panellists today and Kath. And the aged care quality standards have integrated diversity and inclusion across all of its standards. And the Centre for Cultural Diversity and Ageing has worked with the Aged Care Quality and Safety Commission to embed diversity, equity, and inclusion in its training programs to assessors and auditors. So it's on their mind. It's not going to be a nice thing to do anymore. So you've got to watch this space. You need to do this. It's going to be something really central moving forward, and it should be. So we also have an infographic which links the aged care quality standards to our inclusive service standards that we have at the centre. And so this is a bit of an overview here. So the step one is get commitment from your board. That's been mentioned today. Of course, Kath's mentioned it in Bolton, Clarke, and of course Stephen mentioned it, that we had board approval for their strategy. And Yvonne is one of the leaders, and she's talking about it, and so is Gail. So it's about how the leaders are speaking about it. The second thing is partner with a diversity consultant or a leading agency to help drive the process, or have a dedicated role. And that's really important as well, as mentioned by Bolton Clarke, that they have a dedicated diversity coordinator role. Create a D&I working group or committee. That's really important, to actually have a space where people can have conversations that are ongoing, and that people that are interested in the topic, that doesn't just rely on the one person either. And then it's an ongoing working group with the terms of reference and key performance indicators. Step 4 is actually review your data. What kind of diversity do you have in your client population? And does that match the diversity data in your local community? It could be LGBTIQA+ communities. It could relate to, new and emerging communities, migrant communities, people who identify, who come from Aboriginal and Torres Strait Islander backgrounds. In your local community, how many people are at risk of homelessness? And how are we consulting with people that live on the streets, rough sleepers, or even people that are living in, who knows? We just need to know the diversity of our community in order to respond to it. And then step 5 is undergoing an organisation assessment. So that is assessing where your organisation is at in relation to diversity, equity and inclusion policy, procedures and approaches. And we can help you with that through our Inclusive Service Standards organisational assessment tool, but also our Inclusive Service Standards portal, which you all have free access to, and 30 minutes of free tutorial on how to use the portal. And what the portal does is it generates a report for you on where your organisation is at on your Inclusive Service Standards journey. It's really exciting, and it's good for strategic development. And then, of course, step 6 and 7 and 8 is around, what do you need to do? So you've realised that perhaps you don't have a diversity strategy. Okay, so one of the steps this year may be you want to develop a diversity strategy. And that would be included in your action plan. And then from there, you would craft your initiatives. Which special needs groups do you want to focus on? Do you want to, spend the year developing the working group and looking at some of your data? Like it can take time. It doesn't have to happen overnight. Step 9 is communicate and promote your plan initiatives across the organisation and to your clients and to the wider community through public launches, through your website, through internally within your team. That's really important as well. And then, of course, step 10 is just to measure your results through your KPIs and then review the process. So it's a circular thing. It's not like, okay, tick, we've done that. It's forever. It really is forever. So that's what we have sort of suggested. And there's a little bit of an overview more around the steps and then some key considerations. And then we've put in a good practice example here, which is one of our dear friends and allies here at the Centre, Uniting New South Wales ACT, who have launched their diversity inclusion strategy. And so we encourage you to have a look at their strategy. And so as you can see here, they have established a D&I team who's responsible for the D&I strategy. They have a working group with diverse voices across the organisation. They have informal and formal networks of employees through focus groups, surveys and interviews. And they also have external partnerships that they've consulted with across the pathway. The strategy goes for 3 years and it's been endorsed by the executive and the board. So it's really exciting to see that. Just some links to some useful resources here. And then finally, some definitions around what is diversity, inclusion, equity, and intersectionality. And I know that that's definitely a big one, which is the fact that we make up lots of different things, don't we? We don't encourage a silo approach here that, Lisa is cold. I'm much more than cold, or, whatever it might be. Like, we're all much more than who we are. So it's not about boxing people in. And that's what intersectionality is about. It's about the fact that, we come from a range of different lifestyles and a range of different identities. And that's definitely mentioned in the Aged Care Diversity Framework as well. So thank you so much. We encourage you to have a look at that and let us know if you wanted to review it or there's any changes that need to be had in that practice guide, because we're always open to feedback as well. We've got some comments here in the chat before we go on to further support. And just one comment on by Sabon around so much of this work is high level, but we need to engage and work with staff and clients to gain investment. Exactly. Isn't it about organisational change? It's about change. And so how do we convince people that it's important? And reach out to us, because we can sort of support you around some of the rationale for this work. If you look at it from a compliance perspective, it's the fact that, it's a legal thing to do. You need to do it from a legal perspective. There's a moral argument, there's a social argument. There's, arguments around risk and compliance. So actually, Sabon, if you don't mind making a comment about what do you think, why do you think the resistance is there, or where do you think that resistance comes from? So I don't know if you wanted to further comment on that. Frontline staff. Okay. So the direct care workers. Yeah. Okay. It's good to know. Yeah. If we seek feedback, thanks, Gail. It's all about that whole co-design, that seeking feedback from people, that continuous conversations about what are the barriers to service access. But imposition is an interesting one. Should we impose things on people? Should we involve them? I mean, we know that over 35% of our personal care workers or our direct care staff come from culturally and linguistically diverse backgrounds and, diverse backgrounds at large. So maybe they can start to co-design the policies or, procedures in the organisations and get, and have a voice. Thanks so much, everyone, for your comments. Just to end here now on where to go for further support. Of course, we're here, Nikki, Biliana, myself. We've got a network of diversity consultants that can help you on your journey. We've got our nationally funded website for you to access. We've got our good practice stories for you to learn from. Submit your good practice stories at any time. We always want to hear about what's happening on the ground. We have our diversity webinar series for 2022 to be continued. and of course our practice guide and our multilingual resource page. These are some of the topics relating to our practice guide. Thanks, Liliana. So just for you to all free to download. Food and nutrition has been a very interesting topic at the moment. Food for thought. Let's think about the way that food connects to culture and mental health. That's been a big one in residential care facilities at the moment. So thanks everyone. And digital inclusion has been an interesting one too. And we've just launched our promotional poster. So that can be printed in colour in A2 size and just stuck up anywhere, because people don't really know that we exist. We are part of the Partners in Culturally Appropriate Care Alliance, and we're funded for another year until June 2023. So we're here. We're not going anywhere. So feel free to download the poster. Thank you. And finally, our diversity webinar series for 2022. We've got Applying a Diversity Lens to End-of-Life Care in April, Conscious Inclusion, Moving on from Unconscious Bias, the 18th of May, and Managing Equal and Mutually Beneficial Partnerships with Multicultural Communities in June. The second one, Conscious Inclusion, Moving on from Unconscious Bias, relates to that whole idea of, I started to see in today's forum actually, leaders starting to reflect on the way in which perhaps they identify themselves to be, or they've, within their teams, how they've seen diversity play out. And that's really important. It's a really mature way of talking. So thank you. And I think, yes, and just to remind you that we have our May session for our communities of practice, where we get to talk about these things in a couple of hours. We link you to a diversity coach to have facilitated conversations about diversity planning and practice. And I think we're going to look at some of these topics and some of the themes around diversity planning for our next one in May. So that's all for free as well. And that's in collaboration with our PCAC Alliance colleagues and, of course, Margaret from Uniting and Dale Park who's a diversity expert from Diversity Training and Consulting. So that's exciting. And just a reminder, we are part of the Partners in Culturally Appropriate Care program. They also have a website. So there's a provider in each state and territory. So the Centre for Cultural Diversity and Ageing is the Victorian provider, although we do have our national website that we run. And most of our webinars are for a national audience. However, there is a consultant in each state and territory to which your organisation is located in, and their details are on the website. Increasing access to translating and interpreting services in aged care projects. And one of the things that has come out of the way in which culturally, linguistically and faith diverse older people experience aged care is through language services. And so the Centre for Cultural Diversity and Ageing has been working with the Department of Health around a new project, which is pretty much allowing or giving permission for government-funded aged care providers, in fact, all aged care providers, to receive free translations. So that's really exciting moving forward. And in line with that as well is the improvement of accessing interpreting services, of older people accessing interpreting services. So how can they better access interpreting services? So we're working with the department around that. In terms of staff training, that's another initiative from the Department of Health that's going to come out of this project, which is resources put into staff training and certain topics that are needed that everyone can access, as well as the free translations, tailored translations. And that's the email address for you to ask them to actually request what tailored translations you need. Do you need a lifestyle calendar in Arabic? Do you need, to develop a new resource on how to understand the fee system for people that speak Turkish? Whatever it might be, it's your opportunity to submit. And if you don't remember this email, you can send it to us at info@culturediversity.com.au and we'll send it to the team.
We encourage you to go to our website and also go to visit us on Facebook and LinkedIn and our YouTube channel. We'd like to thank Sarah Burrell-Davis, our digital and content producer, and from Red Hat Films for all her support. And we'd like to thank all our panelists and our hosts for today. And hopefully you'll join us next time. Thank you and goodbye.